Polycystic ovarian syndrome, or PCOS, is a fairly common hormonal disorder seen in about 5 to 10% of women in the reproductive age group. PCOS is characterized by three main issues. The first is a lack of regular ovulation, that is the release of eggs from the ovaries. The second is elevated levels of testosterone. And the third is the presence of fluid-filled sacs or cysts on the ovaries. In women with PCOS, there is a combination of hormonal imbalances such as low estrogen levels combined with high androgen levels, insulin resistance, and metabolic abnormalities. These result in a number of symptoms such as irregular or missed periods, weight gain, excessive growth of hair on the face and the body, and having trouble conceiving. So how is PCOS diagnosed? There is no single test for this. Some of the things that go into diagnosing PCOS are number one, your medical history. This includes the symptoms you've been experiencing, such as irregular periods or heavy periods or a missed period. The second is a physical exam to look for excessive facial hair, acne, thinning scalp hair, skin discoloration, or skin tags. Number three is a pelvic exam to check your reproductive organs for any enlargement, masses, growths, or any other changes. Number four are blood tests to check for hormone levels to make sure there's no other issue that is causing your irregular periods or high androgen levels, such as a tumor on the ovaries or a tumor on the adrenal glands. Blood tests are also used to check your blood glucose levels, your cholesterol levels, your triglyceride levels, your insulin levels, and an insulin tolerance test. Depending on the specifics of your case, your doctor may even want to check your thyroid levels. And lastly, a pelvic ultrasound to look at the thickness of your uterine lining and to look at your ovaries for the presence of cysts. Cysts may not always show up on ultrasound in women with PCOS, especially if they're taking birth control. So if you are experiencing symptoms associated with PCOS, such as irregular periods, excessive facial hair, excessive weight gain, acne, or something else, speak to your doctor to see if you might be a good candidate for further evaluation and treatment of PCOS.